I talked about the enablers, the conditions, and some of the challenges of commissioning for outcomes, and particularly for commissioning for capitated and for capitated and outcome-based commissioning. I think we talked about the main enabler being the knowledge, beliefs, and attitudes of the commissioner, and the recognition that their job was to turn taxpayers' money into better health, fewer inequalities and access to high quality services. Their understanding that activity-based commissioning doesn't actually readily align with the core value chain, and that the question that activity-based commissioning brings, how many outpatients, how many hip replacements, become tangential, that by buying services from individual elements of the pathway, they tend to lock money up, make it difficult to for providers to do the right thing and to innovate even when they want to. And that actually the other consequence that follows is that commissioners end up writing detailed clinical service specifications, trying to tell expert clinicians how to do their job, which perhaps isn't the best way to build constructive relationships with the community, nor is it the best place to make use of the knowledge that exists, the fabulous knowledge that exists within the health service. By contrast, we said actually if they thought about the role, you can conceive of it first and foremost as an agency relationship with the public. And actually a lot of the moral authority for the commissioner in asking for things, different things from their providers, comes from the quality of the relationship they manage to establish with their public. They're representing them both as taxpayer and as service user. And so I believe that they should be investing more time and effort in building that dialogue, that relationship, and understanding what the public want from what are the outcomes they want from their investment in care, in the health service and the care system. And then transmitting that, and then identifying providers who understand what those outcomes are and are capable of delivering them. And then we talked through that sounds very simple and straightforward. We talked about the ramifications of all of that, and actually how that the environment is becoming more sympathetic to that approach, more permissive. And if you look at Simon Stevens' speech at the Confederation, I said I think I'd have been very pleased to have written it. I didn't, but it talks about commissioning for outcomes. It talks about the need for provider reform. And that was really where we started, and the rest of the conversation followed on from that starting point.